We all know how much healthcare has changed in our lifetime. Gone is the time when a patient would spend days or even weeks recuperating in the hospital. Yet in-home care is often impractical. But thanks to Manor Care and their MedBridge centers, patients receive all the care they require to get them home, but without the extended stay in the hospital.
I look at the oak tree there, you see that horseshoes now embedded in the tree, and how much pieces of the farm apparatus we found around here.
So my husband brought me down, and I got to the our gray barn and started down, and I knew I was home. I mean, it just was, there was something very emotional about coming in when I had been gone for 104 days.
MedBridge is distinct units within our Manor Care skilled nursing facilities that are for patients needing rehabilitation after an event such as orthopedic surgery, cardiac event, or chronic illness. They come to the MedBridge unit to receive rehabilitation and nursing services to get them stronger before returning home.
That's okay. And now do you see the ice cream on the side? Move a little to your right.
I chose to stay here. I was here about a couple of years ago and for therapy, and I loved it so much. They're wonderful people here, the staff, all of them. The doctors, the nurses aides. That's so wonderful. I feel guilty. I feel like I'm at a spa. I get my meals 3 times a day and a snack if I want it. I get my medicine 3 times a day comes. Anytime I want a nurse, they're there for my breathing. I use oxygen when I'm in my room. I mean, the staff is wonderful. The doctor's wonderful.
A unit such as MedBridge provides multidisciplinary, comprehensive medical, nursing, functional, restorative care to older people discharged from the hospital who often have coexisting complex medical conditions and severe functional impairment.
Post-acute care centers are necessary because of the changes in the hospital environment, because the hospital is focusing on acute care. So what that means is if you are ill, you would go to the hospital. Once you are stable and well enough, they like you to move on to a level of care that meets your needs, which is a post-acute care center.
The reason I came to Manor Care was very clear. On March 6th, I had a very tremendous fall in my house and on my brain and in my head. I went to shock trauma, and I was in a coma for many days, and I was in shock trauma for 19 or 20 days.
Towards the end of the intensive care, shock trauma was telling us that Ann needed to go to a rehab facility, but she had a trach and a feeding tube, and she had no use of her body in terms of her arms and her legs. And all the primary care facilities in the Baltimore region would not take Ann. There's a resident in shock trauma who recommended that we come look here. Medicare has a very high rating of Manor Care Towson. We met Melissa, who was the therapist, the respiratory therapist, and told us that Ann would have a single room, and they were able to take her. They had an opening, and we were very pleased because we didn't know what to do. And a day later, Ann came in at 4 o'clock.
I think that we had a very positive idea about what Manor Care was about, and I became even more positive when I started working here and meeting some of the people. So I think in general it was a very positive information.
Manor Care as a company provides skilled nursing care. We also have assisted living centers. We also have home health, and we do have hospice, which is known as Heartland Hospice.
When I said I want to go in a nursing home, I said I don't want to go any place but here. I said I've been here, I know what the food's like, I know what the nurses are. They had one nurse here. She was here about 30 years. But I mean, that's the kind of people they have here. Good people. And they're caring people. They care about you.
Here at MedBridge, we have a dedicated pulmonary program, and we provide comprehensive care to patients with chronic lung diseases and acute exacerbations of chronic lung diseases. We are fortunate to have the presence of a pulmonologist and a team dedicated to people with those specific medical conditions.
I was at Manor Care for almost 3 months. I came in on the 24th of March and left on the 17th of June. I just required so much attention, and there was so little I could do initially that they just needed to keep working with me, and it became, it became very successful.
The ultimate goal of a unit like this is to provide direct medical oversight, careful attention to their medical issues, together with optimizing functional state, and the ultimate goal is to try and get the person back to their pre-morbid living arrangement, ideally their home setting if that's where they came from.
Personnel here in the therapy, the occupational therapist and the physical therapist, were the ones that helped pull Ann out of this shell that she was in. They were relentless. They worked with her just about every day, and that's the reason why they said to me that they thought that Ann could go home, and I said, I don't see how they can do that. And I had to totally change our plans because we were planning to take her to an assisted living, and they kept saying she can go home, and that was about a month before she left. And what a gift that was for them. We've seen many angels helping us here.
Patients that will really benefit from a MedBridge unit are those that have the goal of going home. So those patients maybe that have undergone some type of surgery such as orthopedic surgery, cardiac surgery, or maybe they're suffering from a chronic illness such as diabetes. Those are the patients really that are for the MedBridge unit. So when they come to the MedBridge unit, their goal is to get home, and that's our goal too.
Our population obviously is exponentially aging. With advancing age frequently comes increasing frailty. When an older person is admitted to a hospital, they often become even more functionally compromised, and oftentimes, even though their medical condition may be stabilized, they often are unable to return to their home setting because of functional impairment.
I would recommend Manor Care Towson. It turned out to be a very kind and loving place to be, and I just feel like it was very fortuitous that I was here and that I met all these wonderful people, and I had all this wonderful care.
And you have all the comforts of home. Really, you have nice people that are patients. They're all nice people. And then you have the nice staff, the nurses, the doctors, the aides. It really is a home. It's a home away from home.
For more information on Manor Care-MedBridge, visit their website at manorcare.com.